Hello everyone, let us discuss IVF treatment step by step. So welcome back to my channel. I'm Dr. Shaivalini, senior gynecologist and founder of AMVI Fertility and IVF Center. If you're planning for IVF or just curious about how it works, so this video will give you a very clear understanding each stage. So IVF is highly effective treatment for couples who's facing infertility. It involves combining an egg and sperm outside the body in a laboratory and then transferring the fertilized egg, which is known as embryo, back to a woman's uterus. This process can help to overcome various fertility issues, and it is a very good opportunity for couples to start a family. So first step in IVF process is an ovarian stimulation. Every woman normally releases one egg per menstrual cycle, but for an IVF we aim to produce multiple eggs, which increases the chances of success. To achieve this, we use a hormone injection about 10 to 14 days. During this time, you will have a regular ultrasound and few blood tests to monitor the growth of the follicles. So these follicles which develop and mature, these are the eggs which we retrieve during the ovum pickup day. This is a very minor surgical procedure which is done under the guidance of an ultrasound. So this procedure we usually give a very mild sedation and we do in our lab on the next step. On the day of the egg retrieval, a sperm sample is collected from your partner. In our lab, we combine the eggs with the sperm to achieve fertilization. This can be done in two ways. Normally a conventional IVF where a sperm is mixed with the eggs in a petri dish and left to fertilize naturally. Nowadays ICSI is a major which has improve the techniques of IVF, that is like we take the sperm and fertilize manually with the egg in such a way that the embryos are cultured in a lab about 3 to 5 days after the procedure. During this period, our embryologist will closely monitor the embryos to select the healthiest one for the transfer. The goal is to identify the embryos with the best potential for a successful pregnancy. Once we have selected the best embryo, it is the time for the embryo transfer. This is a simple and painless procedure where the embryo is placed into the uterus using a very thin catheter. So the procedure does not require any anesthesia and usually takes only few minutes. After the transfer, you will rest for a period of short time before you go home. After the embryo transfer, there is a 2-week waiting period. Before we confirm a pregnancy test, this can be a very anxious time, but it's important to stay positive and take care of yourself. About 10 to 14 days after the transfer, we will do a blood test to check for the pregnancy. If it is a positive, you will continue to monitor your progress. Success rate for IVF can vary depending upon factors like age and specific fertility issues being addressed. At AMVI Fertility and IVF Center, expertise of our fertility specialist and our state-of-art IVF lab can give you the best possible chances of success. I hope this video has given you a clear understanding of the IVF process, and please share this video with others who might benefit from it. Thank you for watching. I'll be seeing you in the next video.